Hi everyone, it's Stacy again. Here to make another video about my journey through Brachymetatarsia and having my toe lengthened on November 22nd, 2017. So you guys haven't seen me in a couple weeks, and I apologize for that. I had an issue where my pin site got infected, so I wasn't feeling very well. I was taking antibiotics to clear up the infection and taking pain meds to deal with the pain. So that pushed me back a little as far as making videos. So what I plan on doing is hopefully I can make 2 videos this week, and hopefully I can stay on schedule like I would like to moving forward. So today I planned on talking about surgery day, talking about my experience surgery day, where I had my surgery, and how it went. So my surgery, like I said, was on November 22nd, 2017. Dr. Bradley Lamm did my surgery. He is one of the podiatrists at the Paley Institute. He also still does surgeries in Maryland, where he was when I first reached out to him to do my surgery. But in 2016, the summer of 2016, he actually moved down and he started working at the Paley Institute. We had a couple of appointments together, and after that we scheduled a surgery. And I showed up the day before surgery. We did lots of paperwork, we did lots of tests, I met with the anesthesiologist, all that stuff. And after that, I actually met with Dr. Lamm as well the day before the surgery. Met with my nurse, everything. And that was done at St. Mary's Medical Center in West Palm Beach. They have great customer service. Everybody was really nice. Nobody made me feel like I was asking too many questions. Nobody made me feel like I was bothering them. It was a great experience. That is a great hospital, St. Mary's Medical Center in West Palm Beach, which is right next door to the Paley Institute in West Palm Beach. Actually, if I can find the address, I will either post for you post a screenshot at the end of this video, or I will say it out loud at the end of the video. So I showed up the day before surgery. I had my pre-op, which was, like I said, paperwork, and that was it. Just pretty much getting me prepared for the day of surgery. The next day, I showed up for surgery, and there was some time. We were sitting in the waiting room for some time, and after sitting in the waiting room for some time, they moved me into the room where there's curtains and what are those things called? Like stretchers, not really stretchers, but they're hospital beds. And they had me change into a hospital gown. I changed into a hospital gown, and they also put an IV in. They asked me if I wanted it either here or if I wanted it in my elbow area, and I had them put it in here because I've never had an IV here, so I just didn't like how there's no meat here, so I didn't want them to put it in there. So they ended up putting an IV in my arm. It was actually an IV with like a plastic straw, actually, which was super cool. I've never seen that before. Even though I've never gotten an IV done before, I always thought it was a needle that was put into your arm and you had to keep your arm straight, but it was actually a straw and I can bend my arm. I didn't, but I could. So they hooked me up to the IV, pumped me with some salines. Also, I wasn't allowed to eat for 12 hours before surgery because of the anesthesia and all the stuff they're gonna give you. They want to make sure that you don't throw up. So they put me on the saline drip, and we waited for quite a bit. Dr. Lamm came over. He came in to make me feel at ease, in which he never fails to do because he has a great personality and he knows exactly what he's doing. He's one of the best. And he came over. We had a short conversation. I brought my paperwork for my temporary handicap placard for my car. He signed that for me. I gave it to my husband. My husband came with me. And because you're going to need to bring somebody with you because you can't drive home the day after surgery, and somebody there for support is great. So my husband came with me. Dr. Lamm came over. He signed the leg that he would be working on. He put yes, and he put his initials on it because that's just protocol. He has to sign it. He has to sign where he's going to be doing his work. So he signed my left leg because he did my left leg. I only have, like I said in my previous video, I only have brachymetatarsia on one foot. He signed my left leg, and he left, and he said it would be another 30 minutes. So 30 minutes later, another anesthesiologist came over. We talked again about the anesthesia. She spoke to another anesthesiologist about my anesthesia. And they sent me to the bathroom. They gave me a pregnancy test. And they had me make sure that I didn't have anything metal on my body, piercings, all that stuff. They ask about that because there is a machine in the OR that will make metal really hot. I actually had little metal things in my dreads that were there for decoration, and I had to take them out. So my husband, the poor guy, had to sit there and pick them out one by one because they were just scattered everywhere in my hair. But he was a good sport, and he picked them all out. And after that, they checked on me one last time. They made sure I was comfortable. They put something in my IV. Yeah, they put it directly in here. They didn't put it on a drip, but they put it directly into my arm. And it was for the ride to the OR. So you weren't feeling anxious, and you weren't feeling, some people don't like to be pushed on gurneys, or in moving beds. So they give you something to kind of keep you calm. So I got to the OR. I don't even remember the ride from the holding room to the OR. I remember saying goodbye to my husband, but I don't remember that ride. I got into the OR. I remember the lights. I remember them putting a mask on my face and telling me to breathe deeply. I remember hearing someone say that some people say they can taste it when they breathe it in. I did taste something. It wasn't disgusting or anything, but honestly, maybe I breathed in twice, and I can't remember anything after that. When I woke up, I remember looking around for my husband. My husband was right behind me. The nurses were like, "It's okay, everything's okay, your husband's here." And they moved me into a room, my room for the night. So when you come out of surgery, when I came out of surgery, they gave me something called a nerve block. They told me about it before surgery, but I didn't understand what exactly it was going to be. But they gave me, I guess they injected something into my leg, and I was numb from, I want to say, halfway up my calf down to the tip of my toes. I couldn't feel anything. It was just absolutely numb. So that wore off maybe a couple days after surgery. I was numb for quite a bit. They would ask me to move my toes, and I thought I was moving them, but I couldn't move them. They would ask me if I can feel things, and I really couldn't. After a while, I had my surgery on the 22nd. On the 28th, I went back for post-op, touched my toes. They could feel everything. I was able to move my big toe a little. It just kind of dies down after a while. They sent me home after surgery. They tried to get me to eat, but I wasn't feeling well. The anesthesia makes you really nauseated. You're probably not going to eat anything. I drank a lot of apple juice, and the next morning, I want to say, I didn't go to the bathroom that night. I didn't go to the bathroom the night after surgery. I had surgery around 12:30 in the afternoon. Surgery was an hour and a half, about an hour and a half, almost 2 hours, and I didn't have to use the bathroom for the rest of the night. I didn't want to go because I wasn't sure how I was going to get there. But I had a nurse who was very, actually, I take that back. My nurse, Steven, he did come in later in the day, in the evening. He came over and he was like, all right, it's time to stand up and go to the bathroom. And I was like, I can't even feel my foot. How am I going to? And he put a walker in front of me. He's like, okay, we're going to walk to the bathroom. And I was like, I can't feel my foot. It was very uncomfortable to walk to the bathroom, but I really needed to use it. I remember now that I really needed to use it, so I got up. I limped, using mostly my heel to walk, and I got into the bathroom. It was painful. I think I cried at first. But I will say over time, everything gets much better as far as pain goes. They tried to get me, I think I didn't eat until the next day. My throat was really sore. I had some phlegm and I was coughing. And when I was coughing, I saw some blood and I was concerned. So I called my nurse and he told me it was because they put a tube down my throat. I didn't know that they put a tube down my throat, but that was causing my throat to be sore. So I drank a lot of apple juice, a lot of ice chips, didn't eat that night. I tried, but I didn't feel good. My head was spinning. But my toe looked so much better already. It was on top before, and I'll show you guys the before picture at the end of this video. It was on top before, and it was really far back, and they broke it and they pushed it down into place. So even though it was shorter, it was shorter than my pinky toe. It was in place, like aligned. But before it was back here and it was on top. So that excited me. And I didn't see Dr. Lamm again until post-op, but his surgical resident, Dr. Martin, came in the next day and he showed my husband how to turn my fixator. I ended up turning my fixator myself, but at first I thought that it was going to be painful, so I was telling my husband that he needed to learn how to do it because he was going to be the one to turn it because I wasn't sure if I could inflict any pain on myself. But I'll talk about it more later in a different video, but turning the fixator didn't hurt at all. I'll actually post a video of what it looks like. Excuse me. So after that morning, I went to the bathroom a couple more times, and PT came in, physical therapy came in, showed me how to use the walker. We did all that stuff, and I was supposed to leave with crutches, but there weren't any crutches for my weight limit, so they sent me, just to make sure that there weren't any accidents, they sent me home with a walker. And I ended up, they also wrote me a script for a painkiller, which was oxycodone, Valium, which is like Valium is supposed to, after surgery, it's supposed to help with muscle spasms, but it's also like a anxiety medication. And they also sent me home with 90 pills of antibiotics. So they send you home with antibiotics just in case you get an infection and you can't get to the doctor. They send you home with it as a precautionary measure. They send you home with the Valium because people are known to have muscle spasms after these surgeries, and they send you home with oxycodone because the pain is supposedly really bad once the nerve block wears off. I will say that I took the oxycodone for 3, maybe 4 days after surgery, like when they wanted me to take it. After that, I started taking it as needed. I was supposed to take one every 6 hours, but I started taking them as needed. If I felt a lot of pain, like something that Tylenol couldn't help, I took an oxycodone, and I took it before I went to sleep because the oxycodone was making me drowsy, and I just didn't like the way it was making me feel. although it was relieving my pain, it was putting me to sleep at random times. I was eating dinner and I was passing out. I was falling asleep. So I didn't like that. So I decided that I was going to back off of it a little, and which was fine because the pain wasn't that bad. And so going back to the day after surgery, which is the day that I left, I didn't spend a whole 24 hours. I think that I got into the room around 7, maybe. I can't remember. My husband told me the time, but in the evening I got into the room, and then we were out of the hospital by noon the next day. And we stopped at CVS to get we stopped at a pharmacy to get the prescriptions, and then after the prescription we went straight home, and that was about it. So surgery day was better than I could have expected. When you get the external fixator put on your foot, that was my surgery. I can't remember if I mentioned that in my first video, but I got the external fixator put on my foot, not the one step. I know that some people get the one step where they take a bone graft and they immediately lengthen the toe, but I got the external fixator put on my foot, and you know, they break a bone, they break your fourth metatarsal, and they broke my fourth metatarsal, and then I turned in the Allen wrench, and over time. So Dr. Lamm told me I was supposed to turn for 40 days. Actually, this weekend is going to be my 40th day, so I look forward to that. And so I thought the pain was going to be a lot worse, but because I've never broken a bone before, so I was thinking, man, there's going to be, you know, they snapped my bone. It's going to hurt terribly. And it actually did not hurt like what I was expecting. I think when my pin sites got infected, it hurt more than it did on my way home. My foot was really sore. I actually, trying to walk on it was really hard for me. Even now, it's still kind of hard for me because maybe it's because I'm a plus size person, and maybe not, but my foot, it just feels like a lot of pressure. And it's not a bad thing. It's just that I won't be able to walk like some people are able to walk regular with their surgical shoes on. I just won't. I borrowed a knee scooter from a friend. They're usually really expensive, but thankfully I had a friend who tore his ACL, and he had a friend who lent him a knee scooter and told him to keep it and to lend it out to other people that are in need. So he lent it to me, even though I'll be on the knee scooter for about 4 months. He didn't care. He just thought, you know, it's for the cause. So he lent it to me, and I will say it is a big help. I also saw that there's a thing called an iWalk, which is super cool, but I can't get one because I exceed the weight limit. But the iWalk is something that helps you walk while your foot is injured, and that's a great thing to look into as well. I want to say it's a couple $100 maybe, but it's something that if you can get into the groove, it's something that I'm sure will be of great use to you while your foot is out of commission. So I think that is all I have. So that is all. If you have any questions, please do not hesitate to put them in the comment box. I will try to get to you as soon as I can. If there's anything I missed that you would like to know, just ask. And I think that is all. I look forward to making another video with more of my experiences, and have a great evening, you guys.